So what is your advice? A lot of people have actually asked questions about the government advice, finding it quite confusing. And we've had a question about meeting family and in particular grandchildren, where people should be seeing them, and how to deal with children going back to school as well. Yeah, so I don't know if you'd be able to kick off with something around that.
Yeah, so the shielding advice has changed over the period of the last 5-6 months. So initially, probably everybody, anybody with aplastic anemia would have been shielding. What we know now is that what we know about COVID is it doesn't, in general, if we take aplastic anemia out of this at the time being, seem to affect children that severely, and young children don't seem to spread it perhaps as much as adults and older children. Our own experience in aplastic anemia internationally is we're not seeing people getting severe COVID, so not in the pediatric population. And so I think if, in terms of trying to give some guidance about shielding, so shielding being, for example, in essence, staying at home, clearly if somebody's had a recent diagnosis, if they've had immune suppression recently, so within the last 6 months, if they've had a bone marrow transplant and they still haven't recovered their immune system, then they would still need to be shielded. Okay. Now, then there are areas where, when do you start to say that starts to end? So the official guidance and the transplant consultants across the whole of the UK have written a guidance document which should be consistent, regardless of which centre you go to, and this is for children, is if your neutrophil count is above 0.5 and your lymphocyte count, which is another subset of your white cells, is above 0.2, then in principle you can then think about you'll be more in the vulnerable group and not in the extremely vulnerable group. So extremely vulnerable means essentially you have to stay at home. Vulnerable means that you can do things, but you can go to school, you can mix with other households, but it's not so much at risk as extremely vulnerable. So the key figures are a neutrophil count of over 0.5 and a lymphocyte count over 0.2. And I see somebody's written about immunoglobulin. In principle, immunoglobulin replacement just on its own is not an indicator anymore to do shielding. At the beginning of the lockdown it was, but not currently. That's not to say that, and what I say to all families is, what the guidance I've given is quite black and white, but in reality it's not that. And it requires careful discussion with your treating teams and the families, discuss what's the best way forward. So I don't think there's a one fits all for everybody, and I'm happy to try and guide through what the guidance is and say what I think. But that's in essence the most latest up-to-date guidance. So a neutrophil count above 0.5, lymphocyte count above 0.2, providing you're not on high-dose steroids, providing there's no major problems in terms of severe infections, etc., and you're not on high-dose steroids, you don't need to shield. So most children say after 6 months after a transplant are no longer now going to be an extremely vulnerable group. There's quite a lot of information now I've given, and it has changed. So as I said, in the beginning of lockdown, everybody was shielding, and shielding basically meant essentially staying at home and not going out. And that meant no mixing with grandparents. That meant parents also potentially not going to work. We've changed that for the vast majority of our children to being vulnerable, which means you can in principle go to school, siblings can certainly go to school, and parents can go to work. There are, as I said, a small number of children who are newly diagnosed or who recently started treatment with, say, ATG, or have had a bone marrow transplant, certainly within the last 6 months, who still remain on immune suppression and their immune system hasn't recovered, and the key figures are neutrophil count above 0.5 and the lymphocyte count above 0.2. If you haven't met that criteria, you still need to shield.
Thank you. So can I just check, I've had a comment of someone asking whether you're able to answer this, around whether the figures would be the same for an adult.
I don't know. So this is just for the children. So this would apply, say, up to 18. I don't know about the adults.
Thank you. That's fine. It might be worth noting, and we'll take a note of that question, and it's something we can ask Dr. Austin on the 2nd of September, which is another Q&A kind of webinar taking place, and that is aimed at adult AA patients. So if we can't answer the question right now, we can certainly take it away and answer it at the next session. So if that's okay, we'll do that. And then there's a couple more people joining a little bit later. And so those people can just pop themselves on mute whilst we move on to the next question, and pop your comments in the chat box. Someone's just asked, is a lymphocyte a white blood cell, as regular figures are given are red, white,
yes.
and platelets?
So when you look at your blood counts, you see the hemoglobin, you see your platelet count, and you see white cells. But within the white cells, there are many different types of cells, and we're all familiar with neutrophils. But also a subset of the white cells are lymphocytes. And within the lymphocytes, you have a population called also B cells. So they're a subset of the lymphocytes. And for example, B cells are the ones that make hemoglobin. And I see that some of the questions are relating to immunoglobulin replacement. So yeah, lymphocytes are a subset of white blood cells. So when you get your full blood count, you'll be able to see on the lymphocytes, you'll be able to see, you look down to white cells and then look at the subsets of those white cells, you'll be able to see neutrophils and lymphocytes. And if the neutrophil count, as it says, above 0.5, lymphocyte count above 0.2, and they're otherwise well, that then meets the criteria to say they're in a vulnerable situation, which means they can mix. Vulnerable still means you've got to be careful. So it means, for example, you don't go in public transport. Wouldn't recommend that. And all the other kind of things that means with that. So very careful hand washing. SIBs have to always wash their hands. Everybody has to be does still have to be really careful. But it does mean in principle you can go to school.